Hello everyone, thank you so much for joining us for the next Inside Health series coming to you live this lunchtime. And today we're tackling a subject which will affect every single woman at some stage in their life, and that is the menopause. So whether you're tuning in because you're going through the menopause now, or you're perimenopausal, starting to see some symptoms, or you simply just want to learn more about it to help either yourself or other people, there'll be something for everyone in the next 60 minutes, so please do stay tuned. Thankfully, the subject of menopause has become much more mainstream now, and even words like perimenopause, which weren't even mentioned 10 years ago, are now becoming much more understood. And by taking away the fear of this natural life stage, we can all get the advice, support and information that we need. So today we're going to be having a really open conversation with the help of my two amazing guests, Lisa Snowdon, who is a radio broadcaster, TV presenter and author of the best-selling book, Just Getting Started, which focuses on her own journey through perimenopause and menopause. And Lisa says, by learning and listening to what your body needs, you too can make it through menopause with a smile on your face, what we all need to hear. And we'll be getting into that with Lisa very shortly. We're also joined by Dr. Sam Wild, who is the Women's Health Clinical Lead for Bupa, and she has a wealth of experience supporting women through the menopause, so she'll be sharing her professional advice with us today. And today is also about your questions, so please do get in touch throughout today's show. We want to hear from you. What are your fears and what would you like to ask Dr. Sam or Lisa? So pop your questions in the chat and we'll be getting on with those a little bit later. So let's get started then by welcoming the lovely, lovely Lisa Snowdon. Full disclosure, Lisa and I are good friends and part of the This Morning TV family together. So we've actually had plenty of chats about this topic over the last few years. And Lisa's story, I think, is one that's probably familiar to quite a lot of women out there. She's super passionate about opening up on this time of life and supporting women through the menopause. So let's start off, Lisa. Maybe you can tell us a little bit about your menopause journey. What age did you start getting symptoms and how was it for you?
So thank you for having me. It's so nice to be here today with you girls. And such an important topic, it really is. It's all about educating all of us so we know what to expect. So when I look back, it was roughly about 10 years ago. So it was my early 40s. I'm 52 now. So back 10 years ago, there was no conversation going on about perimenopause, menopause. Perimenopause, that word didn't even exist in my world, had no clue. So the symptoms that I first started to experience were really low mood, very anxious. And this was coming from, like, I was always a really positive person. I could always kind of take most things in my stride. I do get nervous before I do things, and sometimes I get a little bit out of my depth, but it felt so different. It was anxiety where I couldn't control my emotions, and then really low moods where I was really down and really felt depressed and would cry a lot, like really easily. And that was really scary because I didn't recognize myself, and I think that was the start now of those symptoms of the estrogen, which I now know was kind of starting to sort of decline in my body. Now, there's so many different symptoms. There's about 60 and counting, and you won't experience all of them. But the symptoms I'm going to tell you might freak you out, but I don't want it to, because looking back, if I'd have known what was happening, I would have been able to navigate it. But I will talk more about the symptoms, but don't be scared. So it was anxiety, low mood, feeling really depressed, a couple of panic attacks here and there where I didn't want to leave the house. My cycle used to go completely out of whack as well. So it would go from 28 days to 15 days to 2 days, and then I'd bleed constantly in very heavy periods as well. That was scary and should always be checked out, which I'm sure Dr. Sam would say, and you obviously too, Dr. Zoe. So it was all these different things, and I sort of went undiagnosed for about 6 years, trying to work out what was happening to my body. And it felt like somebody had invaded my body and had taken over my thoughts, my sleep, my waistline. Everything changed, weight gains, and it was just a real roller coaster of different symptoms that kind of shape shifted over those years. The lack of sleep was quite hideous, and the hot flashes are also quite embarrassing when you're at work. And I did want to give up work. You and I see each other at the studio, and some days I was like, I can't do live TV. I can't even get on the tube. I can't get myself out of the house. So it was those moments where I was kind of just crippled with fear and anxiety that were probably the worst. But I think looking back, and I always say, be prepared, don't be scared. If I'd have known what to expect, I could have been like, okay, the anxiety, it's not me. The low moods, this isn't my life now. I don't hate my partner. I don't hate my life. This is just my hormones. I would have known to be able to maybe not have as much coffee if I'm feeling anxious, maybe do some breath work, maybe do some there's ways that you can hack it. But I didn't know, and I think looking back, as hideous as the symptoms were, the not knowing was the scariest part, absolutely.
And you said, so 10 years ago, you hadn't heard of the word perimenopause, which I think many people listening will probably feel the same about that. Were you aware of menopause, and what was your understanding of menopause?
So I knew that the menopause was something that I was going to go through, but in my head, it was going to happen to me when I was perhaps 65, 70, because my idea, in my head, the image of a menopausal woman was much, much older, really white hair, really frail, maybe needing a walker to walk with. It wasn't me in my early 40s, even though I do colour my hair. I do get the greys. I'm physically fit and I'm strong and I've got a lot of energy, and it didn't look like me. But the word perimenopause, I mean, even about 8 years ago or 7 years ago, I was typing perimenopause and it wouldn't even recognise it on your phone. It would try and, correct you, spell autocorrect. So yeah, menopause was something that was going to happen way in the future.
So when you were told that these symptoms, which you didn't know what was causing them, when you finally found out that it was perimenopause, it was because of your hormones, how did you feel about it? Were you frightened? Was it a relief?
It was a mix of emotions, really, because when you can pinpoint what's happening to you, you've got that kind of okay, so I know what it is. I'm not losing my mind. I don't need to leave work. Maybe there's some help for me out there. But at the same time, when you're told that word and you don't know what it means exactly, I felt very lost. I felt very scared. I felt very alone. I didn't know who to talk to. Obviously, my partner didn't know what was happening, and it wasn't being spoken about. I couldn't go to my friends. I couldn't go to somebody at work and be like, have you heard of this perimenopause thing? Have you experiencing? So it was still quite taboo. Yeah. So I felt one moment, a kind of a eureka moment of okay, I know what it is. And the other one was what's going to happen now?
Yeah. And I mean, obviously today's conversation is all about empowering, not instilling fear, but doing the opposite. But, you've just been very honest there about some of the distressing symptoms that you went through. What were the sort of darkest moments or darkest times or thoughts that you had?
The sleep being impacted on top of everything else was really hard, because you're just tossing and turning all night long. You're having hot flushes, night sweats, and you're boiling hot, can't sleep with the covers on, and then you start shivering because the bed's soaking wet because you've literally sweated. And then you're up and down going to the bathroom all night as well, and then you wake up the next day and you haven't slept, or you get up the next day and you're expected to go to work or expected to do things or just continue in life, and it was just how am I going to do this? So they were some of my darkest moments, I think, when I was just racked with sleep deprivation, and I just couldn't think. I couldn't put one foot in front of the other, let alone try and get dressed or try and do anything. And they were some of the lowest points. I absolutely can look back now. But you're right, this, like I said, be prepared, not scared. Even though these symptoms sound so hideous, if I'd have known that there's things I could do perhaps to help with those hot flushes and night sweats, then you've got it. You've totally got it. You can get in control of it all. And you can maybe change your bedding, make the bedroom cooler. I like to take magnesium before bed. There's different things that I can do now that I know are going to help my sleep. But it was quite scary and it was quite lonely.
I think that brings me on to my next question now, which is about where are you now? So this all started 10 years ago. I think that's something that a lot of people are not aware of, that the whole menopause transition can take 10 years for some people. Yeah. Where are you now? Have you had your last period? Is that done? Are you past the 1 year that you're actually now menopausal?
Oh yeah, I am very post-menopausal. I haven't had a period, it's coming up to 4 years.
Right.
Which is amazing. And that's I love knowing your period. I thought that was something that I was going to be positive. Yeah, it was such a positive thing. There was no more pain, there was no more heavy bleeding, there was no more oh my gosh, am I going
tampons?
Yes.
I always think it's unfair that we have to buy tampons. And
all of the tampons, and I needed a lot of tampons towards the end, because it was a heavy flow. So that was something that I was so happy to kiss goodbye to. So that was incredible. But yeah, I'm postmenopausal. I've kind of been trying to talk about this subject more and more, empower women, get them to feel the best versions of themselves, and see this as the beginning of the start of something new rather than the end of their life. Because I think a lot of women, when they get the diagnosis that you're perimenopausal or you're menopausal, it seems like that's the end for you, that you should give up work, that you're not seen anymore, that you're not, you know, sexy, that there's so many sort of stigmas involved and attached to being perimenopausal and menopausal. And I think that, you know, it doesn't have to be like that. It's the start of the new relationship with yourself, where you can take control, you can do things that have always been on your bucket list maybe, you can be kinder to yourself, you can start putting yourself at the top of that list. Because I feel like we kind of like, it's like an elastic band and it gets stretched and stretched and stretched and it almost just pings and you've got no more in the tank anymore. So you have to really conserve your energy and you have to just, yeah, like look at your life, what you've done, what you've achieved, and start to really like yourself and reconnect. So I always think that I just want women to realise that it's the start of a really beautiful new relationship with yourself, and it's a positive thing. And that's why my mantra was like, I'm just getting started.
Yes.
Don't try and stop me.
Yes.
Yes, I'm 50, but what else do I want to do? My life's gone so quickly. I don't want to write it off now just because I'm not having periods anymore and I've had a few years of horrible symptoms. No way. I want to talk about it. I want to help women. I want us all to talk so we've got the advice and support and love that we need just to get us through this next stage, and then there's no stopping us, girls.
One of the best things about your book is it's a guide really around, well, it's about your story, but also it's a guide as to how to look after yourself, about self-care, the various different aspects of self-care. And do you think that is one of the most important messages we need to give to not just women, to everybody out there, that this is a time when a woman needs to start looking after herself?
Yeah, absolutely. And also, it just needs a little bit of patience and support and empathy from others around you, you know, whether it's your partner, whether it's your children. It's like we all need to talk about it, not just women, but with our children, with our partners, with our work colleagues. You know, this isn't something that they're going to catch. It's not contagious. And it just needs a little bit of like understanding that there's just a few years here and there. And it might take somebody a bit longer. Like it took me quite a long time to kind of work out what was happening, and a few wrong diagnoses from different doctors. But we will get there in the end. But it is really important just to be kind to yourself, and so that self-care isn't selfish. And you just sometimes need to take an hour here and there for yourself. You just sometimes write your list and you might not get through half of it. Don't worry about it. Just like let it go and just, you know, do nice things for you. Take a walk around the block, have a bath, you know, go out for a coffee with your friends, like do things that are really important, have that sense of community, and just take the pressure off of yourself.
I think when it comes to self-care as well, what will work for one person will be different to what works for another. But what's really worked for you, or what have been your favourite things that you feel have helped you through this time?
So exercise for sure. I find that a lot.
And you're up and in the gym early, aren't you?
I'm a morning person. Not everybody likes to do the morning session. I like to get it done.
I've seen you at 6 a.m.
Get up at 5 and do a 6 a.m. workout. But then I'm done, and I can just then I've got the whole day. In the winter, it's harder. I'm not going to lie, but exercise really helps because it just. In that hour, you've got that time to yourself and you can just forget about everything else that's going on. And if you have got a worry, I find that you can kind of process it when you're in the gym or going for a power walk or going for a run or whatever it looks like for you. That hour and a half, a class, whatever, yoga, mindfulness, breath work, all those kind of things really take you out of that go, 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 that fight or flight, which I find for us ladies in our perimenopausal and menopausal years, we can't exacerbate that fight or flight because you're already like running like so fast and you're hot flushes and everything. You need to slow everything down, whether that's Pilates, breath work, just sitting there on your own, even like taking your shoes off and going for a walk on the grass. If there's a green patch and you're having a bit of a moment, I would just pull the car up, get out and go for a walk.
Just feel connected, connected with the earth.
Ground you again. You just sometimes we need to do things that just chill us out. But I find keeping a food diary really interesting because I think certain foods really do impact how you feel and symptoms. And you know, a lot of people get gut issues as well at this time of their lives. So keep a food diary, see what foods start to irritate you. If coffee is going to aggravate you too much and really exacerbate the stress, don't do it, or do a decaf. If alcohol, which is a crutch for some of us, because you get to the end of the day and you're like, I just need wine. Sometimes we can't do that because then we're up all night and it's tossing and turning and that kind of aggravates you as well and you'll get maybe more hot flushes. Spicy food, things like that. You just need to kind of listen to what your body's telling you because it's giving you those warnings, and just try and get a little bit of a handle on it because we can do so much for ourselves.
I mean, I could talk to you about this topic for ages, but I'm going to come to... In fact, actually, before I do...
Yeah.
Reflecting back on your own experiences, if you had one word of advice for all of our viewers out there, what would it be?
I can't just say one word, but it would be prepared, not scared. Like, don't fear this time in your life. Just kind of read up on what's going to happen. Don't worry that you're going to get all of these symptoms, but just if you get a little, this could be perimenopause. Yeah. And just kind of arm yourself with information, do some research, and that would be my word of advice. And also that this is the start of a new time of your life. Don't see it as the end. It can be a beautiful thing and a really positive time.
I love that. I love that. Before we do go over to Dr. Sam, remember, if you do have any questions at all that you want to ask, we're going to be coming to those very, very shortly, so do pop them in the chat. So it's time to welcome Dr. Sam. How are you?
I'm good, thank you.
So Dr. Sam Wild is Bupa's clinical lead for women's health and an absolute font of knowledge, because you help women with their symptoms at every stage of the menopause, all of the time. So let's get started with your day job. You work in a clinic.
I do.
And who do you see, what types of women do you see, and what sort of experiences are they having, and what are they going through?
So seeing women at all stages of the menopause, so perimenopause, or you know, they can even come before they've got the perimenopausal symptoms if they want to discuss what might happen in the future. But women that are going through the menopause, and women post-menopause as well, so any age. And we have to remember as well that menopause can affect women at any age. As I said, the pictures always show older women, but we've got to remember that women in their 20s, 30s, 40s, you know, upwards can go through the menopause. So, you know, we mustn't neglect that younger age group as well.
And the average age is 51, isn't it? Actually, in white women, I discovered fairly recently that for black women and Asian women, you can expect it to be a few years earlier, which is really interesting. But so therefore we think of it, I think we do, we grow up thinking this is something that I don't have to worry about until our 50s, but as Lisa explained, the symptoms of perimenopause can come a long time before.
And they can be a decade or more. So really, it's not unusual for women in their early 40s to start going through the perimenopause and develop those symptoms. And yet I see a lot of women that have been told by their GP that they're too young to be going through the menopause, and they're absolutely not.
What are some of the fears and worries and concerns that you typically see?
I think whilst it's great that we're talking about the menopause more and more, it isn't always a positive story behind it, and I want to bring Lisa in to speak to all my patients, because it's amazing how she's framing it in that it doesn't need to be a negative experience, and that's what women are worried about. They're worried about what symptoms they might get, how long they might last for, and so, you know, they're scared. And so I say exactly as Lisa's just said, you know, that this can be a really positive time. If you're getting the right support and you're getting the right treatment, it gives you that chance to take stock, reflect where you are in your life, listen to your body, and embrace that next stage of your life. It doesn't need to be scary.
I think the other benefit of reframing it in this way and talking about it positively, it's likely that women are more likely to come forward and seek support if it's not just deemed a negative thing. Do you find that sometimes fears and worries prevent people coming forwards, or people have been struggling for months or even years and not coming to see a doctor because of the stigma and because of the fear?
Yeah, and there's a lot of reasons behind that. I think some women feel that they should just get on with it. You know, as women, we often don't prioritise ourselves. Everybody else goes ahead of us, and so haven't got time, just need to get on with it. It'll go. Some women are told by others, sometimes by, you know, their mums, you know, you don't need any treatment. I sailed through it. What's the problem, sort of thing. We didn't have that back in my day. And then there's the scaremongering as well. People are worried about taking HRT. There was a lot of studies done 20 years ago, and we still, unfortunately, the media still picks up on those studies. It's been talked about for a long time now. And women don't know the latest evidence, and they're being given incorrect information. So that's why it's so important, as Lisa said, to make sure that you educate yourself.
Yeah, I think it's important to pick up on that, because there is sometimes fear-mongering, and certainly there's a lot of fear around things like risk of breast cancer when taking HRT. I mean, the message is that for the majority of women, actually, HRT, often it's the case that the benefits will outweigh any risk. So should people be afraid?
They shouldn't. And it's always an individualised treatment, and the consultation needs to be individualised. We need to talk about, you know, that person's past medical history, their family history, and the different treatment options available to them. But it needs to be an informed choice, and we can talk through, you know, what those risk factors for breast cancer are. The studies that I mentioned, you know, they were using older women in their 60s that often had a lot of other risk factors for breast cancer as well, using older types of HRT that we just don't use these days. So really, when I talk to women about those studies, we've got to consider what treatment we've got available now. It's actually the progesterone part of the HRT that gives the breast cancer risk, which a lot of women don't realise. We have more modern types of progesterone now. It depends how long you take your HRT for. So actually, if you're taking HRT in your 40s and you're replacing those hormones that you would have had at that age anyway, there's no risk. We only count the risk once you get past sort of 51, when you normally would have started to go through the menopause. And also, we have to put it into perspective that for most women, there's lots of other things that they're doing that are going to increase their breast cancer more than HRT would. So if your body mass index is over 30, so if you're obese, you double your risk of developing breast cancer. If you drink more than 2 units or 14 units of alcohol a week, you're, again, increasing your risk of developing breast cancer. If you smoke as well, if you're not exercising for 2.5 hours a week. And so actually, when we think about it, if HRT allows you to get your life back a little bit, so that you can lose some weight, you're feeling motivated to exercise, you're not reaching for that glass of wine at the end of the day, you can give up smoking, you're actually overall reducing your risk of developing breast cancer. So there's a lovely chart that I show my patients, I'm sure you've seen it, Zoe, and it's a great pictorial chart just to, you know, really put it into perspective, and that really helps. But as I say, it's an individualised consultation and a personal choice.
And I think my message to people would be, if that is a fear of yours, don't just not explore HRT. Go and find out exactly what those risks are. Look at these diagrams, let the doctor explain it to you, so then you have the information that's relevant to you to make that decision. And if you still don't want to take it, if it's not for you, you know, that's absolutely fine. Not everybody needs to, not everybody wants to, and not everybody should. So I think what would be really good at this stage would be a little recap of what are the symptoms of menopause? So Lisa's rightly said, there are loads of them. So what are some of the common ones, but also what are some of the lesser known symptoms?
Okay, so I mean, Lisa's been great, she's listed loads, but I always start talking about hot flushes and night sweats because they're the symptoms that everybody immediately associates with the menopause, and 3 out of every 4 women, you know, will suffer with those. But a lot of women don't realise that palpitations can be associated with that too, lightheadedness, poor sleep, as we talked about anyway, sort of feeling faint, that sort of thing. So that's something else that, you know, I tend to talk about. In my experience and from the patients that we've seen at Bupa, we know though that the main symptoms that really affect women the most are the emotional and the psychological symptoms, and often they're not talked about. So again, Lisa said a lot, but anxiety is very common, low mood, low self-confidence, irritability, anger. You know, women describe suddenly feeling like the Incredible Hulk. It just comes from nowhere, and you just flip. And then after that, you then get the extreme guilt and self-blame and really dwelling on what's happened. So that's really common. The poor memory, poor concentration, and this really affects women, brain fog, and this really affects women in the workplace as well, where they just feel that they're not up to doing their job anymore. They're double checking everything that they've done. They're forgetting words mid-sentence, which I am awful at. You know, they're forgetting people's names as well, and then they think that their colleagues are talking about them, and you know, they probably haven't even noticed, but you know, we blame ourselves, we get that imposter syndrome, I can't do my job anymore, you know, I want to stop. So that's really common.
I've heard of women saying that they just don't have the confidence to drive anymore because they don't trust themselves to get in the car and drive safely.
A new journey in a car, like the parking situation, where am I going? Like all of those things, you start to think about it so much more than you just used to jump in the car and go. And I'd be like, wait a minute, I need to plan my route. Where am I going to stop if I need to go to the loo because I need to go to the loo all the time? Where am I going to park? So absolutely, like you just lose your confidence so much.
Going on the underground as well, flying.
Well, especially then if you get hot as well and you might have a hot flush.
That's it. So, and I think a lot of women in COVID times, that really exacerbated that as well, when women were forced to stay at home and they almost got used to then being at home. So it made it even harder to get out when life went back to normal again.
And it always, whenever we have these conversations, I just always think, you know, nowadays, we do talk about this more and more. The shift over the past 10 years has been huge, but it just made me think back to when women really didn't have anyone to talk about it, and they were going through all of this without any support, and even their own family not really understanding what they were going through. It makes me think about my own mum, actually.
Breaks my heart. And our nans and grandmas and just really struggling on their own.
I know. And then I think, let's talk about treatment. So we have mentioned HRT already, but what exactly is HRT?
So HRT is hormone replacement therapy. So we're replacing the estrogen, and that's the hormone that's dropped. That's why we get our symptoms. And for women that have a uterus, a womb, they have to have progesterone as well. So the progesterone protects the lining of the womb from too much estrogen, basically. It can overstimulate, it can cause a lot of bleeding. So that's generally what we give as HRT. Some women may also have testosterone added too, but not everybody needs to have that. And HRT comes in different forms, so it can come in tablet form, it can come in transdermal form, so patches and gels, a spray as well, and it can come in topical form. So for women that suffer with vaginal dryness, one of the symptoms we haven't talked about yet, you can use that there as well. So vaginal dryness, again, very, very common. We know that about 70% of women suffer with it, but only about 7% of women receive treatment for it. Wow. So again, as a GP, this is something that I bring up with my women because I know that they may not have the confidence to do, and I literally just come out with it and just say it. Are you suffering with vaginal dryness? Do you need some help with that?
And then they'll say yes, but only if they're
often than not, they say yes.
And the thing about the topical estrogen creams, gels that are, the vaginal treatments, is that they don't have some of the risks that we've spoken about associated with them, do they? They're completely safe.
Exactly. So we were talking earlier that some women who have breast cancer, depending on their treatment, may be able to still use topical estrogen.
Which is really, really great. So HRT is the gold standard treatment for women who are having symptoms that are affecting their quality of life. But what are some of the other treatments that women might choose to take or be prescribed for some of the symptoms of menopause?
So I always start with lifestyle. Before we discuss any treatments, we talk about lifestyle, and as Lisa said, it's so important to have a healthy lifestyle. So for a healthy heart, it's really important to follow a Mediterranean type diet. So plenty of plant foods, lots of oily fish, not too many processed foods, lots of whole foods instead. Our risk of heart disease increases after the menopause, so that's why it's so important to look after our heart. Our risk of osteoporosis, thinning of the bones, also increases, so we need to get enough calcium in our diet. So again, we'll talk about that. Exercise, not just for that mindfulness aspect, but to keep our flexibility there, keep our mobility there. Can help if you started to gain weight. A lot of women will gain weight and struggle to lose it again. But even if you're not losing weight, you've still got all those other benefits. Again, you're exercising for your heart, you're keeping your bones strong, you're keeping your muscle mass. It's a case of use it or lose it. Bingo wings do exist. So you've got to keep going.
I always think with exercise, we're all huge advocates of exercise here, but if we think about that list of symptoms related to menopause, you can combat quite a few of them with exercise alone. I think especially the emotional symptoms and the confidence, even if it's not affecting your weight, if you're not losing weight, or if you're gaining weight, losing weight, or your weight staying the same, I know, as everyone will know, if you've gone and done a good workout, when you look in the mirror, you might look exactly the same as you did beforehand, but you feel better. The language you use to talk to yourself is more positive, and I think that's something that women really need at this stage in their life.
And you make better choices with your food afterwards as well. If you've had a good workout early on, then you're like, right, I'm going to drink more water. That's going to have a massive positive effect, and then everything else that follows throughout the day.
I do have one question. We kind of touched on it, but are there some people who should not take HRT?
Yes, so some women who have had breast cancer should not have HRT. That's a really important conversation to have with their oncologist, with their breast surgeon, maybe a menopause specialist as well. Some women who have had breast cancer may choose to have HRT, and that may be absolutely fine for them. But again, it needs to be an informed choice, and it's very much individualised.
Okay, and one final question, Sam, before we move on to the viewers' questions, which there is still time to ask, by the way. Can you give us your top 5 tips for living well through the menopause?
Okay, so I've thought long and hard about this. So I think number 1, educate yourself, definitely. I'm going to echo everything you've just said anyway. My top 5, educate yourself. Read as much as possible. We've got loads of information on our Bupa website, read Lisa's, but there's loads of amazing information out there now. Have a healthy sort of menopause lifestyle. So, think about what you need to have. Reduce your alcohol intake, don't smoke, that sort of thing as well, which we haven't talked about. Seek support, so, speak to your friends, speak to your colleagues, find out, what they're doing, get that sort of advice from them. Prioritise your self-care, again, as we were saying, mindfulness, cognitive behavioural therapy we haven't mentioned either, which can be really beneficial for some women. Meditation, so whatever works for you to get that mindfulness. And then finally see your doctor. It's got to be, hasn't it? You know, come and see your doctor. The more you've read up before you've come really helps the GP in the consultation as well. But, you know, just make sure that, you know, you're getting that support and treatment that you need.
Thank you. Thank you
I could
so
listen
much.
to Sam all day.
I know. But now we are going to listen to both of you some more because we're going to answer. We've got lots of questions coming in, so I'm just going to crack on with it and start asking you some of these questions. Just before I do that, just a reminder: there will be a recording of today's session sent out afterwards, so you can share it with your friends, share it with your family, or you can watch it again if you want to. I'll be watching it back. So our first question, it's one for you, Lisa. How do you support somebody going through the menopause? I mean, I guess thinking here about your lovely George, who really helped you, didn't he?
He really did. And I didn't know what was happening to me, so I don't know how he just knew that there was something else going on. Yeah. He just had a feeling. I mean, he just was very patient, very supportive. He's actually in the book as well, because I wanted advice for loved ones, and he wrote a whole bit on it, which is
lovely.
Which is so lovely. And I think he was just like, he was like, you know, it's not about, it wasn't about him, it was about me, and it was just about him trying to support me. So being patient, not judging me if I did have a rage, and then run upstairs and shut the door and start bawling my eyes out through guilt. It was just like no judgment. He was just like, I'm going to be patient, we're going to get through this. You know, he was like, we're in this for the long haul. You know, this is just a little blip. We're going to get through this. And so luckily, I had that support from him, and I think that that's kind of what you need to do. You just need to take a step back. You might not always have the answers for that person who's going through it, but just be patient and just be there as just a lovely, loving kind of shoulder to cry on or a big hug when they come to you, because it can be quite hit and miss. And just dodge the plates if there's any plates in the kitchen, and the angry rages that might come your way. Don't take it personally, and just be there for that person, and fingers crossed you'll get through it.
I think just listen, isn't it? And you know, again, I always say to partners, if they can educate themselves as well, remembering that everybody's journey is different, but you know, just listen to that person's experience and ask them what you could do for them. We always say about, you know, maybe you could exercise together. Maybe, you know, your partner could help you with some healthy meals. You know, cooking, that sort of thing.
Walking together.
And I think sometimes I would say it's forcing your partner to do the self-care. Say, right, this afternoon I'm going to go and do the shopping, I'm going to do the laundry. I want you to take 3 hours for yourself to do whatever you want to do, and don't worry about anything. If there's anything else you want me to do, I'll take care of it. Just give him permission for the self-care, because even though as women, and we keep saying it's important to look after number one at this time, I know many women still won't.
There's always a million other things to do, aren't there?
There's the kids, there's the dog, there's the husband, there's the sister, there's everybody, and you're like, no, I'll deal with me later. And it's like, no, but you won't. You know, it'll get to the end of the week and you've done nothing for yourself, and that's just going to make it worse.
And I think the permission giving goes both ways as well. I think for the person going through perimenopause, menopause, give your partner, give your kids, give your friends permission to be there for you, inform them, let them know what's going on, and give them permission to be involved in it as well.
Yeah, mummy's having a really bad day, you know, I'm not feeling myself. And, you know, like my sister's little kids are brilliant. They'll like do facial, they do a little foot massage on her, and it's just really cute when you just ask for that support and that help, and just be really transparent about the fact that you're maybe having a really bad day or struggling this month or whatever it may be. So
and that's great, because that generation then grows up knowing
exactly
what it might be like.
Absolutely.
Because our parents didn't talk to us about it, did they? Okay, Sam, one for you. I've used contraception for years, so no periods. How do I know if I'm menopausal?
Okay, so it can be a little bit tricky, so usually a good one to speak to with the GP. If you weren't using contraception, it's quite simple. So it's 2 years after your last period, under the age of 50, you don't need contraception anymore. And over the age of 50, it's 1 year after your last period. Right. But if you're using contraception, usually if you're on the combined pill, we stop it at 50 anyway, and we move you onto a progesterone-only product. But what we can do is we can do a blood test when you're over 50. And depending on the level, we can either say, great, you've hit that level, just need to give it another year now, and then you can stop your contraception. Or it might be, well, you know, not quite there yet. Let's check it again in another year and see, you know, where you're at. It's much easier if women just keep using contraception till the age of 55, when we can definitely stop it. But you can do that. The other thing to remember though, if you're using a Mirena coil for contraception, you can use it as part of HRT. So that's fantastic, because then we just add some estrogen. The woman's not having periods anyway. It's great. But if you're using it as part of HRT, you can only use a Mirena coil for 5 years. It has a longer license if you're using it for contraception. It's just increased up to 8 years in the last few months. So you just have to make sure that the Mirena's in date. So again, it's one to chat through with the GP, but there's great guidance there. So,
and another question for me, actually, because I genuinely don't know the answer to this, getting a little bit more technical, but if somebody's taking the contraceptive pill, the combined pill, then they're taking synthetic hormones, whereas the HRT...
a bit more natural, the ones we use these days.
Yeah, natural hormones. So if somebody was taking the combined pill and actually their body was reaching menopause, would they have symptoms?
Now, this is really funny because, in a way, they shouldn't, because they're actually getting higher doses of estrogen than they would in their HRT. Yeah. But we still find that some women will still get some symptoms. And actually, they do better on the HRT when we're using the more natural sort of body-identical hormones, the estradiol, than they were on their synthetic combined or contraception. So, in theory, no, they shouldn't. But actually, in practice, they do. But yeah, we have to stop the combined pill at 50 anyway. So usually then a woman may start to get some symptoms depending on what she's been swapped over onto.
And I think that sort of flags up the difference between a regular GP and a menopause specialist GP. So, you know, as regular GPs, we don't know everything about menopause. I think we're getting better. But yeah, I think for people who've got complex situations, especially sort of we gave the example of women who previously had breast cancer who want to maybe explore whether they can take HRT, you're going to need to see a specialist to help you with that. Okay, a question for Lisa. Hot flushes are really embarrassing me. I'm scared of going out and going to work. Any tips on how best to manage them?
Yeah, so they are really embarrassing, and it's, you know, if you're giving a presentation, and I really feel for you because you are so conscious, you feel like your feet have been set on fire and you can feel this hot flush travelling up and you're like, oh God, it's coming. And you just feel so embarrassed and your top lip starts getting really sweaty. And I think the more you panic about it, the hotter you get. Yeah. So I found a few things. So alcohol, definitely, when I drink, it exacerbates it, as does coffee. And spicy food and things like that. And so more of a plant-based diet, having your phytoestrogens, so your soya beans, your sweet potatoes, more of a plant-based diet, I find really helped me in the beginning, before I was on HRT, to kind of minimise those kind of flushes and those sort of spikes in that sort of... like an energy spike where I was just getting triggered. So that definitely helps. Layers, layer your clothes, and breathable fabric. So cotton always, if you can wear it, that's going to help you to breathe, you know, your skin to breathe more easily, and you're not going to feel so hot and so claustrophobic. And layers, so take the layers off if and when you need them. A fan is really good. A little fan like that, or one of those little battery-operated ones.
You can plug them in your phone now.
You can plug them in your phone. You can put it on your desk. You can just be like, I'm having a moment. You know, you can make a joke about it. But I do understand it is so embarrassing. But those, I think, foods can really help. And I found that sage tea, and sage tablets, they helped for me a little bit in the beginning. So it might help for you. Yeah, so that really did.
And Sam,
minimize it a little bit.
In terms of medications or things that you might recommend?
So HRT, obviously, but there are non-hormonal medications as well. So women that have had a history of breast cancer, for example, might want to use those, or women that just don't want to have HRT. There's some older types of medication on the market, and we tend to use things like antidepressants. This is the one time when I will advocate using antidepressants for menopausal symptoms because they do help hot flushes and night sweats. There's some anti-epileptic medications that we use. There's some really exciting newer drugs coming on the market as well, and literally just out, only available privately at the moment, but showing great promise as well to reduce symptoms. So yeah, again, go and speak to your GP about it if it's becoming a real problem. But absolutely echo everything Lisa said as well. That would be the advice that I would give.
I mean, I think what I'm hearing is there are lots of things that people can do. Everything might not work for everyone, but this is why it's so important to educate yourself, right? Go out there and find out what the information is. Sam, one for you. How do you support women better in the workplace going through menopause? I mean, it's a big question, but have you got any tips on that?
So I mean, we do a lot of work with our corporate clients, and I think again, it's that education, it's that talking about it, it's normalising the conversation within the workplace. So making sure that managers are informed and have been given appropriate guidance and are educated. We have a menopause support group at Bupa with our my colleagues and everybody supports each other, and it's an ongoing Teams chat, but it's fantastic. And they have a monthly call where people can just drop in at lunchtime and join that call as well. So the more it's talked about in the working environment, the better. So that if you are having an issue before a presentation, you can just be honest and say what's going on. Yeah, it's education, it's talking about it. Again, it's listening to what that employee or that colleague might need. Again, recognising that everybody's different, but simple things in the workplace, such as allowing women to sit by a window if they need to, be near a toilet if they need to be near a toilet, looking at uniforms if they have to wear a uniform. Could they work at home? Could they work flexible hours? There's lots of things that can be done. So it's just listening to what women feel would help them and revisiting it as well, because what we haven't talked about so much today is that symptoms come and go and things change. This is not a constant state. So how you might be one year is going to be very different the next. So we have to keep revisiting it as well.
It really does. Some workplaces have a policy now, have policies and procedures around this, don't they? Especially sort of larger corporate organisations. It's worth exploring if there is a policy. Get yourself clued up on it and make sure you're utilising what's in there to help you. I think usually it's having a chat with whoever you need to, who's above you, senior to you, your person, and explaining to them what your symptoms are, what you're experiencing, how they can make it easier for you. And I think actually we're living in a world now where I would hope that most employers would be willing to try and make reasonable changes.
And they absolutely have to now. There's laws that say that they have to do that. So, it can come under discrimination otherwise. So yeah, speak up.
And the menopause affects us women, 51% of the population, but it affects men too. So everybody at our workplace, everybody, every bloke has got a woman in their life that it's for their sister, their mother, their partner, their girl, whoever. So we all need to be clued up on it. It's definitely not just us ladies. It's like everybody needs to be understanding what's happening.
100%. Lisa, are there any supplements you took during perimenopause/menopause? I feel like I am consuming so many. So maybe we can ask that to you, Lisa, and then Sam,
you get me on my bandwagon after go on then.
You can tell us which ones to cross off the list.
It's so expensive. Is that what you were going to say? It's so like you're rattling.
It really frustrates me because
it's tricky. Because there are so many supplements out there that claim to do this and claim to do that.
And it's a market. This age group of women, not everybody, but most women or lots of women may be able to afford to spend money, and women will try anything.
Throwing money at it.
So go on.
Handfuls of stuff. What's actually working?
You already mentioned magnesium before bed.
Magnesium. You must agree with magnesium.
I'm okay with magnesium.
Magnesium is great. I love taking that at the end of the day. I find it really helps to relax me, and it helps with my sleep, and also helps to regulate my body temperature, I feel, at night. So I would definitely say magnesium.
Okay, we'll give that one a tick.
Give that a tick. Doctor approved. 2 doctors approved. Okay. Sage, I found that the tea helped me. Don't have it too hot because that's always going to make you flush. But the sage tea helped initially before I was on HRT. There's other things like ashwagandha and sort of like more natural herbs that I think really help. Maca root, ashwagandha, that are supposed to nourish the nervous system. And just take you down from that really high fight or flight and just kind of try and calm you down. So those are the kind of things that I like to take. But then, I still take my vitamin C, I take my zinc, I take vitamin D now as well. And is it K2? Is it K2 and D, because I recently had a DEXA bone scan and I'm osteopenia, which I've just found out. So upping my calcium, taking vitamin D is something that I'm definitely going to be doing more of, because I had no idea until like last week that I was osteopenia, which is the stage before osteoporosis, as you know, but for anybody who's watching that doesn't. So I'm really conscious of that, upping my vitamin D. But I do take my other supplements too, my zinc, my vitamin C, especially at this time of the year when there's flus and colds and the seasons are changing. But But as far as the menopause stuff, there's so many that claim to do so much. And I think, you know, maybe things like turmeric might help with anti-inflammatory, make you feel less puffy. But I think it's just having a good varied diet, you know, and just being mindful when you eat and trying not to eat as much sugar. And I think that the diet can really help you a lot, rather than spending the earth on like loads of bottles of pills and supplements.
Invest in better quality, more nourishing.
I like
food
collagen as well.
first.
Collagen's great because it helps with the skin, the hair, the nails, the aches and pains, and omegas as well. I'll add them to the list. You're not allowed to say anything. You're not allowed to say anything.
So how about we go at it like this then? So Sam, let's start with, well, maybe vitamin D, because that was the one that
no,
Lisa's
actually
your list.
Absolutely perfect. So all I say to women is nothing replaces a healthy, balanced diet. So ideally, we want you to be getting all your nutrients and everything from your diet, but you can't get enough vitamin D from your diet. Our main source is from the sun, and we don't get enough sunlight in this country. So I tell all my women, and in fact all adults and all children as well, really throughout the winter months, should be taking 10 micrograms of vitamin D a day. It doesn't need to be an expensive supplement. It's, you know, you can buy it in pence from some of the supermarkets.
Pound
and
shops,
this is the thing that
bargain
frustrates
shops,
me.
online.
Yeah, exactly.
You can get a month's supply for less than a pound.
And when you look at some of these menopause vitamins and you look what's in them, the individual ingredients are really only worth pence.
minimal.
And because they put them together, because they put it in fancy packaging and everything else, and that's what frustrates me. So this is the conversation I have with my patients, just to take vitamin D. Yes, magnesium as well, if they are having problems with sleep, but actually the progesterone that we tend to prescribe the most as part of our HRT, eutrogestion, actually has a sedative effect to it anyway. So women are usually getting help with their sleep from that, but magnesium definitely works for some. But they're really, you know, that's it.
So what about calcium? Because we know that is key for women at this stage in their life. How can you make sure you're getting enough from your diet?
So you should be having 700 milligrams a day.
What does that look like?
Okay. There's an online calculator that you can use, which is great. So if you just put into Google, you know, calcium online calculator, it comes up and it's great. And it's remembering that it's not just from dairy products, because we can't have too many dairy products. You know, the fat is not good for our cholesterol levels, but you can get it from things like green leafy vegetables as well, from nuts and seeds, from salmon, you know, that sort of thing, to remember to get it in a variety of ways in your diet.
Okay, so you could, over the course of a week, you know, get just for 1 week, just to have a bit of a trial run.
Most of us eat the same things week after week. So
just put it in there, see where you're at. And actually, if you're not getting enough, then change your foods, or maybe then take a supplement if you think, actually, I don't think I can.
But again, I think most of us can normally do that quite easily from our diet.
Okay, so we've got vitamin D then is a yes. Calcium, maybe if you can't get it through diet. Magnesium may help. What about phytoestrogens? Because it's something Lisa mentioned, and these are plant foods that have estrogen-like compounds in them, like flaxseed and sweet potatoes. I didn't know about sweet potatoes.
If people are happy to eat that, then, you know, they may help, you know, support you in some way. But I think we need to remember, nothing is really going to give you the long-term benefits that HRT is going to have. So when we're talking about any of these herbal treatments, they haven't been tried and tested and stuff. The evidence isn't really there that they're going to do anything. It's fine to take it if you're, you know, happy to spend whatever money it is and you're not spending silly amounts. But, you know, we don't necessarily always know how it's going to interact with other medications that you may be taking, with other illnesses that you may suffer with, and they don't have those long-term benefits of reducing the risk of heart disease, keeping our bones nice and strong, and you know, it looks like there's loads more benefits to HRT as well. We know it reduces our risk of developing diabetes, for example. Looks like it reduces our risk of bowel cancer, developing dementia, of osteoarthritis. So you know, so that's the thing.
So for somebody like Lisa, who now has this diagnosis of osteopenia, which you rightly said is the stage before osteoporosis, so there's some demineralisation or weakening of the bones, is that another reason? I mean, you do take HRT.
I take HRT,
and HRT will be treating that.
Absolutely, but there was a period of time where I was wrongly diagnosed, so that was that kind of window when perhaps I should have been taking HRT. That's kind of how I see it.
So
I don't know. That's a bit
indication for somebody. Perhaps if Lisa wasn't taking HRT,
absolutely.
Even if she wasn't symptomatic now, would we be saying actually maybe we should be thinking about HRT to treat the bones?
And I mean there's other medical treatments for osteoporosis as well, but HRT is a recognised treatment for it, and it'll work as long as obviously you're taking the treatment. But then once you stop it, then there could be an issue then. But that's why you need to make sure that you are getting your weight-bearing exercise, that you are having your vitamin D and getting enough calcium in your diet, and doing all those other things to look after yourself.
Because it is, I think I can reverse it, can't I? Absolutely. So I don't need to do medication just yet. Just keep lifting those weights and eating my leafy greens. Absolutely.
So this next question, I think, actually brings us back to something I don't think we completed answering. So the person says, Sam, lots of people have mentioned pins and needles. Is that a common symptom? And also, I think we never really got onto what are the more unusual symptoms or less familiar symptoms.
So formication it's called, and it's this feeling of insects under your skin, which some people get when their skin feels on edge. But yeah, pins and needles it can be described as well, or tingling, dryness of the skin, all those things are normal. So yeah, very common. Achy joints we didn't talk about before, really, really common. And a lot of women, that is their first sort of symptom that they develop. And I see women that have been sort of around the houses a bit. They've been referred to orthopaedic surgeons or rheumatologists and had physio. And actually when they look back, whatever it is they were suffering with was the first sign of their perimenopause. Tinnitus, it's not that unusual actually to see that.
Burning mouth syndrome.
Dry mouth as well,
Vertigo.
Gum disease, vertigo,
There's some really random ones in there.
Yeah.
And that's because estrogen is impacting on every organ, every system of our body. So really, the symptoms can be coming from just about anywhere,
From the roots of our heads to the tips of our toes. That's why
hair loss is really common. Excess hair as well. You know, all sorts.
Okay, so don't rule anything out. Sam, can I have a blood test to see if I am perimenopausal?
It depends what age you are is the answer to that. So over the age of 45, we don't need to do a blood test. We know that every woman is going to be going through the menopause at some point. So the advice is that we don't need to do a blood test at that age. Under the age of 45, yes, we may do one if we're not sure that your symptoms are due to the perimenopause. And if you are under the age of 40, we would definitely do that because obviously you're a little bit younger to be going through the perimenopause, the menopause, and we might be starting to think about, you know, other things that we definitely need to be starting on HRT at that younger age and keeping a closer eye on you. So yes, depends on the age.
Okay. Lisa, how did your sleep get affected when you were going through the menopause? So you have told us a little bit about this, but maybe you can elaborate a little bit more.
So I'm picking up on what Sam said about the palpitations. So I'd be so exhausted and get into bed at night and I'd start to fall asleep and all of a sudden I'd have this surge of adrenaline that it felt like I was having a heart attack and it felt like somebody was squeezing my heart with their hands. And I was just like, you know, sometimes when you're falling asleep and you feel like you're falling off a cliff and you wake yourself up, it was like that. And so then I'd literally wake myself up and I'd be so frightened to go back to sleep because I thought I was going to die. And it was that sort of surge of adrenaline and palpitation. So that would obviously impact my sleep because I'd be lying there going, I don't want to go to sleep, that's going to happen again. But then when I eventually did fall asleep, I would just get so hot, like literally soaking wet, that the bed would be soaked and I'd have to put a towel on the mattress because I couldn't be able to rip the sheet off and change it and all that. Put a towel down, throw the covers off. Then I'd start shivering because I was soaking wet and the bed was wet. Then I'd put the covers on and that would be that toing and froing and tossing and turning all night. Hot, cold, hot, cold. Then I needed to pee like every hour on the hour, like I couldn't stop. And I was like, where's all this liquid coming from? Like I've just sweated so much. How do I need to go to the bathroom? And it was just like, so I was up and down all night and I was tossing or turning and George would come in for a little spoon. Get off me. And then I'd be like, no, I'm cold, I need you. And it was just like this, like sleeping with a crazy person. And so I was just up and down all night. And then the next day I'd be like, and then you get back into bed and think I've got to do it all again. And then you'd have this surge of this like, and then it would just be like that every night for like about 3 or 4 months.
Is that common? Do you
It's
hear
really
this?
common, and then you get in that sort of vicious cycle then because you're almost scared to go to sleep, aren't you? You know, you're anticipating that it's going to be a bad night, and yeah, it's horrible. So we always talk about trying to keep the room temperature low, as you said, 18 degrees. Don't have a thick duvet. Obviously, you sort of have sheets on the bed, wear cotton underwear, all that sort of thing. A friend of mine a few years ago told me about a chillo pillow. So it's like a cold sort of pillow thing that you can have, and she puts her arms onto that, and that cools her down a little bit as well.
A fan would help now, thinking back.
Cool
a fan
spray,
would be really good. An actual fan on the bed so you can turn it off and turn it on.
That's it, yeah. But yeah, cool water spray as well. So all of those things.
Okay. So again, lots, and also HRT.
Yeah,
It changed all of that for me.
Did it?
Absolutely.
Yeah.
It really changed it. Taking the estrogen, within about 3 weeks, my hot flushes started
I think they are some of the symptoms that do tend to respond quite quickly to HRT, which is great.
Because how long does it normally take? So when people start using HRT, I know often what we do, we sort of talk about a 3-month trial.
Yeah, we give 3 months,
So give 3 months, see how you are.
Yeah.
And review it then. Does it take? How long does it take to?
It really varies. So some women I see, and you know, they come in and they're hugging me, and they're like, "I was better within like 2 days, and my life has changed." And for some women, it really does seem to be that quick. But for others, you know, at 3 months, we may still be adjusting their dose then. So, or even though their symptoms are better, they've not completely gone yet. So, again, it's every woman's different.
Gosh, these are great questions. Do keep them coming, and wonderful answers, obviously. Sam, I feel like my doctor isn't listening to me, tells me I just need to get through it and seems really anti-HRT. How can I be listened to?
It's really difficult, isn't it? So again, I think educate yourself first. So you know exactly what it is that you want, and it's always good to use a symptom checker as well, and write down your symptoms so that you can give that to the doctor, glance straight away so they can see you focused your mind on what your symptoms are, and they can see straight away what it is that you're experiencing. And, you know, if you can, ask at the GP surgery if there's a doctor there that has a special interest in menopause. You know, it won't necessarily always be the most obvious doctor. I think people seem to think if you go for a female of a certain age, it will be them, which often it is because they've had no choice, but sometimes it isn't. So do ask. So ask if you can see someone else. Ask if you can have a double appointment if you need to. It's a lot to talk about in 10 minutes. We have 45 minutes at Bupa. We're really lucky, and even then I'm struggling to stick to time. So, you know, go with as much information as you can to start with. Take somebody with you if you need to as well. So if you need that advocate with you, ask them if it's okay to bring, you know, a friend or family member with you. Write notes. You know, don't be scared to sort of challenge the doctor. You know, be firm but persistent. Be polite, obviously. But you know, if you do leave the consultation and you haven't got what you wanted and you don't really understand why, then do ask if you know you could speak to them again or speak to someone else, just so that's a bit clearer to you. And sort of don't be afraid to do that.
I think another tip I have as well is if you feel able to do so, if you've got someone who can support you, have a look at the NICE guidance, because that's what GPs should be following. And you can, if you're really feeling that you just don't have that confidence to go in and you're dreading it, most practices now you can do an e-consult where you fill out a form, you can put the link to the NICE guidance and say, as per the NICE guidance, I would like to explore because these are my symptoms. And that's one way of maybe starting that conversation, putting all that information down on paper so that when you do speak to the GP, it's done.
And they're prepared then as well.
And they've got the guidance. You've helped them with their job. We've got time for one last question, and it's another one for Sam. How do you know when you've finished the menopause and no longer need
really good question,
HRT?
isn't it? So you will always be postmenopausal, but you won't necessarily suffer with symptoms forever. Some things, such as vaginal dryness, you may continue with issues forever if it's not treated. So some of the things, are going to be slightly different, but you won't be having those hot flushes, those horrible night sweats, the bad sleep, the emotional symptoms forever. But you're always going to be postmenopausal. So on the question of when to stop your HRT, I think there's going to be a whole generation of women that will never stop their HRT. The NICE guidance is very clear, actually, that as long as the benefits continue to outweigh the risks, you can stay on HRT forever. But you need to have an annual review. You need to make sure you're having it in the safest form, which is, you know, transdermally through the skin. But I do think that there will be a lot of women now that decide that they, you know, don't ever want to come off it. As we said, estrogen is affecting, you know, every single bodily function. So, you know, we've needed it until now, so why would we not need it for the rest of our days?
And depending on what happens to you, I guess, you know, if you do have any risk factors for heart disease or other things, I guess that risk-benefit equation will alter as time goes on, which is why you've got to keep reassessing the balance, so you're informed. And you know what?
You can make that decision then.
And you're still having your breast checks and your
Absolutely.
smears and all of that.
Absolutely.
Absolutely.
That's all we've got time for. I mean, we could have continued probably for about 5 hours, but that is all we have time for today. And I'm so sorry if we didn't get to answer all of your questions, but we got through absolutely loads. And hopefully you've all learned a lot from our guest today. Huge thank you to you, Lisa, for being so open, honest and inspirational as always. And Dr. Sam for sharing your wealth of knowledge, putting those myths to bed and just, you know, really, I think to both of you for just making menopause less scary, making us all more informed. And, you know, what was the saying again, Lisa?
Be prepared, not scared.
Be prepared, not scared.
Yes.
I love it. There will be a recording from today on its way to you as well. So do have a recap, share it with your family, share it with your friends, and we'll look forward to seeing you at our next Inside Health event.